yw'r datganiad gan y Prif Weinidog ar coronavirus. Prif Weinidog.
Diolch, Llywydd. Wrth ymateb i'r argyfwng coronavirus, bu'n rhaid i Lywodraeth Cymru weithredu yn gyflymach ac yn ehangach nag erioed o'r blaen. Gan tawr tymor sesiwn olaf o'r Senedd cyn y Sul Gwyn, byddaf yn cynnig crynondeb o'r hyn rydym wedi ei wneud ar draws pob adran o'r Llywodraeth. Rydym yn gweithredu yn mwy Rydym wedi gweithredu mwyn arafu lledaeniad y feirws, cefnogi'r gwasanaethau cyhoeddus a helpu unigolion o busnesau sy'n wynebu amgylchiadau anodd iawn. Yn yr amser sydd gennym, dim ond crynondeb fydd yn bosibl, ond wrth edrych yn ôl, mae'n drawiadol cymaint sydd wedi digwydd mewn cyfnod o 2 fis yn unig. Bydd rhaid i ni ddal ati i weithio ar un mor galed yn yr wythnosau nesaf, wrth baratoi am y camau nesaf. Llywydd, I'll begin with the impact of the virus on our finances. In just over a few months since the Welsh Government's budget for 2020-21 was passed in the Senedd, the budget has increased by more than 10%. We have moved rapidly to allocate those funds, together with repurposing existing budgets and realigning European funding. We have provided £40 million. We have realigned European funding to meet the urgent purposes we face. In the supplementary budget to be published next week, we will allocate more than £2.4 billion in support of our COVID-19 efforts. And that will include nearly £500 million extra to the health and social care budget to ensure that it has the funding it needs to protect the health of the people of Wales. An additional £1.3 billion to the budget for economy and transport, providing a wholly unprecedented level of support for the economy, and a package of measures more substantial than anywhere else in the United Kingdom. This includes the £500 million Economic Resilience Fund, which itself includes £400 million in revenue and £100 million in repurposed capital funding. Less than 8 weeks from the launch, the fund has already provided loans from the Development Bank worth more than £87 million to more than 1,300 businesses, and grants worth more than £100 million to more than 6,000 businesses. The budget has also seen £500 million extra provided to the housing and local government budget, with local authorities delivering key elements of the COVID-19 response, such as continued free school meal provision, increased support for care homes, and for recruiting and managing volunteers. So this funding also includes our support for businesses in the hospitality, retail and leisure sectors in the form of business rate relief and the £10,000 and £25,000 grants which follow, thanks to the enormous efforts of our local authorities. Nearly 51,000 grants have already been paid out at a cost of £621 million. And this support is a vital lifeline for all eligible businesses across Wales. Wherever possible, we have focused this support on businesses headquartered in Wales, and we have made it clear that businesses based in tax havens will not be eligible for COVID-19 financial support from the Welsh Government. So the impact of our investments has been felt across Wales and especially amongst the most vulnerable. We have provided £40 million for free school meals, reaching an estimated 60,000 children in Wales. We have provided £24 million to support the third sector and volunteering. Over 17,500 new volunteers have been recruited in Wales during this crisis, more than double the previous number. And because we have an existing national system for volunteers, we have been able to make rapid use of that huge willingness to help. And so far, 7,000 volunteers have been deployed to help directly in the coronavirus effort. And one of the purposes for which these volunteers have been deployed has been in helping to get food and medicines to people in the shielded group. There are now 130,000 people on the shielding list, with nearly 13,000 added by GPs since the system began. £15 million has been provided to make food boxes available to people in the shielded category, and thousands of boxes have been delivered to those individuals, and 77,000 priority home delivery slots have been made available for that group to be booked with supermarkets. So with thousands of people work in our social care system in Wales, they have been at the forefront of the national effort to save lives. We have set aside £32 million to provide a £500 payment to the 64,000 people delivering personal care in residential and domiciliary care services. For the very poorest in our society, the Discretionary Assistance Fund has provided help of last resort here in Wales ever since the Social Fund was abandoned by the UK government. During the coronavirus crisis, the fund has become an ever more important lifeline for many families. To date, 13,679 payments have been made at a cost of more than £850,000. And so that we can continue to offer this vital assistance, the fund has been increased by £11 million in recent weeks. So the past 8 weeks have seen a transformation in the capacity of our health service. An additional 368 beds have been created through field hospitals, with a further 4,666 available if required. As of the 18th of May, 220 extra critical care beds were available through the huge efforts of our staff. Testing capacity has increased to over 5,300 a day, and 11,000 tests are being carried out every week. Capacity will increase further in the weeks ahead. And 98.4 million items of PPE have been issued since the 9th of March, of which just under 30 million have gone to staff in care homes and in domiciliary care. That scale of provision has only been possible because of our relationships abroad and our ability to make things at home. To mention just one example, manufacturing company Hardshell is creating a new factory in Cardiff to produce up to 1 million fluid-resistant face masks every day for frontline workers in Wales and the rest of the United Kingdom. And it is because of this enormous effort right across Wales by our public services and our people that we have protected our NHS and saved lives. The death toll, with all its human heartbreak, continues to rise. But the number of deaths reported in yesterday's weekly ONS publication showed that figure falling in each of the previous 3 weeks. And as we move into the world in which lockdown is cautiously and gradually lifted here in Wales, so we will need to adapt our approach. This week, the Health Minister announced changes to testing in care homes and in the wider community. We are moving to a wider system of surveillance of the circulation of the virus beyond key workers and key settings through the Test, Trace, Protect strategy published last week. So I have illustrated the breadth and depth of the Welsh Government's activity in response to the pandemic. Our approach has been distinctive in building on our social partnership model and in assisting those in greatest need. We will continue to work with the UK government on measures that require a common approach, and will shortly be making regulations dealing with border controls. Although borders are not a devolved matter, public health regulations covering the operation of these measures in Wales are a matter for Welsh ministers. We are currently considering the right arrangements for implementation here within the UK-wide system. And so I will end by mentioning the impact of the virus on children and young people in Wales. Last week, we launched a new survey asking people between the ages of 7 and 18 for their views during the coronavirus pandemic. Coronavirus and Me asks about their health, education, the impact on social aspects of their lives, and the needs of specific groups. Understanding the experience of young people will be vital to our work on moving out of lockdown and on planning for the future of our economy and society in a post-Covid Wales. All our futures have been at stake in this crisis, but for our children and young people, that has been most acute. We will continue to report to the Senedd on all the actions we are taking to support them and wider society here in Wales. Diolch yn fawr.
Arweinydd Plaid Cymru, Adam Price.
First Minister, on March the 20th, the Royal College of Surgeons recommended that anosmia, the loss of a sense of smell, should be added to the list of COVID-19 symptoms, and that was discussed by SAGE on March the 24th. A paper for SAGE on April the 16th confirmed that the loss of smell and taste was a strong predictor of infection. Why did it take until Monday of this week for you to change the guidance to the public? And do you accept that people who should have been self-isolating haven't been doing so because of this delay?
Well, I don't necessarily accept that last point. Mr. Price outlined a process which went on from March onwards. We changed the policy in Wales, along with all other nations of the United Kingdom, following a statement from the 4 UK chief medical officers. That was the culmination of the process that began with the Royal College of Surgeons statement at the end of March. It was right that the 4 chief medical officers came together, made that determination, and all 4 governments moved together once that decision had been made.
I think it's important to place on the record that clinicians have criticised that length of delay. I mean, 2 months since the Royal College of Surgeons made the case in the first instance. Speed of decision making will no doubt be one of the key questions that a retrospective inquiry will want to look at, as the Health Minister has already alluded this week. You previously said you don't want to get into this now, though I note that O'Brien, the former Permanent Secretary of the Department of Health in England, has said that you need to begin now because setting up an inquiry, because it can take as much as 6 months. Could you make some general commitments today to the principle of setting up an independent public inquiry in due course, to ensuring in the meantime that all relevant documentation, minutes, emails, even Zoom recordings, First Minister, are being safely kept? And lastly, that the inquiry will at least begin to receive evidence before the end of the year, so that interim findings can be published at the latest by the spring of next year.
Well, so I have no doubt that an independent inquiry will be required at the right point in that process, and the documents that are kept by the Welsh Government are kept meticulously, and I'm sure that they will be available for that inquiry when the time for it comes. I'm not able to anticipate when that will be, but the principle that Mr. Price has outlined, I'm very happy to confirm my support for that principle.
Arweinydd yr Wrthblaid, Paul Davies.
Diolch, Llywydd. First Minister, last week you published the Welsh Government's roadmap to lifting Wales out of the lockdown. As well as outlining your government's plans, you had an opportunity to offer the people of Wales hope that the current crisis will end. Unfortunately, your roadmap offered no timescales and no milestones in order to track its progress, including much needed milestones around testing capacity and the virus transmission rate. The roadmap also offers no financial allocations to support delivery of the Welsh Government strategy, and offers very little to businesses and individuals to get through the pandemic, and crucially, it offered no real leadership to the people of Wales. First Minister, is this roadmap the best hope that the Welsh Government can actually offer the people of Wales? And when can we expect to see some timescales alongside your exit strategy?
Well, so there's a whole debate on the roadmap later this afternoon, when no doubt these points can be rehearsed again. I completely reject the member's suggestion that there is no leadership on this matter. The roadmap was very widely welcomed in Wales and beyond Wales, indeed, as a clear statement of the direction of travel that the Welsh Government has set out for people in our country. On timescales, let me say, as I've said before and I've been asked, there is a genuine debate to be had as to whether timescales are a helpful way of setting out the future. In the end, we thought that it was more of a distraction than a concentration on the matters that really deserve our attention. We're doing the same as many other countries across the globe, from New Zealand to Northern Ireland. And timescales are no guarantee, are they? As Mr. Davies will well know. Look how the 1st of June timetable for opening schools in England is falling apart in the hands of the Government of England. How Downing Street last night had to say that the 1st of June was an aspiration, not a deadline, not a timescale after all. So I'm not sure that timescales are an answer to everything. Financial allocations will be set out in detail in the supplementary budget, which will be available to members next week. And I have already set out, so this afternoon, the most generous set of support for businesses anywhere in the United Kingdom. And that detail is available to businesses in Wales and has been very widely welcomed by them.
Well, I put it to you, First Minister, that it is important in any plan that people are given hope when the restrictions start being lifted, and giving an indication of timescales, I don't believe, is unreasonable. Now, let me turn instead to areas where you have thankfully changed your policy. I welcome the news, of course, that the Welsh Government has finally reversed its decision and will be taking part in a UK-wide portal scheme. This means key workers in Wales will be on a level playing field with their counterparts in other parts of the UK in the fight against COVID-19. It's also good to hear that the Welsh Government has changed its policy on testing in care homes, and now testing will be extended to all care home residents and staff in Wales. And I'm pleased that you've listened to my party's calls, and I hope that you'll publish the specific clinical and scientific evidence that has led to this change in policy, so the people of Wales can have confidence in the Welsh Government's decisions. Now, moving forward, the Welsh Government has made it clear that its Test, Trace, Protect programme must become operational by the end of the month in order for lockdown restrictions to start being lifted. First Minister, given that the government would need to increase its testing capacity for those in hospital, care homes and key workers to about 20,000 by the end of the month, and let's be clear, you've not met a testing target you've set so far, how confident are you that you'll actually reach this one?
So let me begin by explaining again why we are now able to be part of the UK-wide portal. And we're very glad to be part of that UK-wide portal. And we're able to do it because the problem with the portal has now been put right. Because the portal, as it was originally constructed, meant the tests carried out on Welsh residents could not be reported into the Welsh NHS or to those patients' records. And in that sense, the tests that were being carried out were of limited value because we didn't know the results of them. That has been put right. We're now confident that tests carried out through that UK-wide portal will be reported back into the patient's record and into the Welsh NHS, and I'm very glad that we've been able to be part of that. Our testing in care homes policy follows the advice we are provided with by SAGE. On Thursday of last week, SAGE changed its advice. On Friday, the UK government changed its policy. On Saturday, we announced that we will be changing our policy in line with that advice. And on Monday, the Northern Ireland Executive announced that it was changing its policy, again in line with the advice. When the advice changes, a policy changes here in Wales. And I know Paul Davies will be glad that on the 15th of May, our own technical advisory group published a paper testing for COVID-19 in care homes, which the Health Minister has made available to all members, setting out the evidence that underpinned that change in advice. We continue to make all the arrangements for the TTP arrangements to be put in place. We are working with others, including with the UK government. Vaughan Gethin took part last night in a meeting with Matt Hancock and with the health ministers of Northern Ireland and of Scotland to share information on how across the United Kingdom those new surveillance arrangements can be put in place. And we continue to work on all the different elements that new approach will need, and to do it in close collaboration with others.
Arweinydd Plaid Brexit, Mark Reckless.
First Minister, last week I asked you about your government revising the coronavirus regulations to remove the requirement that restrictions be necessary. You responded as if I'd suggested the restrictions needn't be proportionate. The record shows that I criticised you for removing the requirement that restrictions be necessary. I concluded by stating the Westminster requirement for any restrictions to be reasonable and proportionate still held, and that you should be held to account against that. Of course, you and I will have different views about whether restrictions are reasonable and proportionate, and ultimately only a judicial review would be determinative. However, why should people in Wales be subject to the most extraordinary, intrusive and prescriptive restrictions on their freedom if they are not necessary? Many who had not before understood the scope of devolved powers don't now like the answer. It's because of devolution, because they live in Wales, and because the Welsh government, and presumably later today, the Senedd, make those laws. The Prime Minister of the United Kingdom may consider your restrictions unnecessary. He may completely disagree with your continuity Corbyn equality tests for lifting them. But as many people are now learning, his writ as British Prime Minister on this, as so many matters, extends to England only. In Wales, the UK government has been stripped of those powers. The BBC has run into some trouble in Scotland for suggesting the First Minister there enjoyed exercising the powers, and the correspondent has rightly apologised. However much I disagree with your decisions as First Minister to continue imposing restrictions in Wales, which have been lifted in England, I accept you do so from motives of sincere public service. However, do you think one consequence of the crisis for us in Wales will be people understanding devolution better, and how far powers have been shifted from the UK government and Parliament to your government and the Senedd? Do you agree that a significant number of people in Wales are only now recognising the extent of this? And how do you respond to the many who would prefer the British Prime Minister to take key decisions rather than you?
Well, so let me begin by agreeing with something that Mr. Eccles said, that the powers that we are exercising are extraordinary, that they represent a level of intrusion into people's lives which is unprecedented, and everything we do has to be tested and tested again to make sure that it is something required to protect the health of people here in Wales. That's where the bar is for me, and we think very carefully indeed about any of the restrictions that we put in place. And we've had this debate on the floor of the Senedd in relation, for example, to second homes, whether more draconian steps should be taken to prevent people from occupying property which they own and which a couple of months ago we wouldn't have dreamt of thinking about whether they should be prevented from doing so. And I've so far come to the conclusion that it isn't proportionate to do that. So I just want to give him that assurance that, you know, we police this line absolutely consciously. We may come to different views on where the line should be drawn, but we are not doing it in any arbitrary or unthinking way. I agree with what Mr. Eccles has said about devolution being brought home to people in this crisis in a way that it hasn't been over the last 20 years. And I doubt that it is true that in Wales people aren't aware of devolution. It is certainly true that people outside Wales and in London appear to have woken up from a 20-year sleep on the devolution agenda. I think people's views in Wales are really clear. People in Wales support the careful, cautious way in which we are exercising the lift out of lockdown. They would rather be here with a government who puts their health, their well-being at the very front of what we are doing, and they do not look enviously on the way in which these things are being conducted across our border.
Antonev.
First Minister, Boris Johnson in Prime Minister's questions today says that he believes it is right to charge low-paid frontline healthcare workers coming from abroad to work in the NHS the immigration health surcharge amounting to hundreds of pounds or more a year. Now, Keir Starmer, the Labour leader and the leader of the opposition in Parliament, quoted a letter from doctors and medical organisations which said, "At a time when we are mourning colleagues, your steadfast refusal to consider the deeply unfair immigration health surcharge is a gross insult to all of us, the country at its time of greatest need." Now, he indicated that there will be a proposed amendment from the opposition to abolish that. I wonder if you agree, First Minister, that this surcharge is an insult to many frontline healthcare workers.
Well, sorry, I didn't have the opportunity myself to hear Prime Minister's questions today, but Mick Anthony has very powerfully given an account of the debate there. Could I put his points in the wider context? This week we have been seeing again immigration proposals from the UK government that seek to distinguish between high-skilled and low-skilled people coming into our country, to have arbitrary salary caps that prevent some people from being recruited to do vital work. And just to say again that just as in the instance that Mick Anthony has reported, so in that general case as well, the Welsh Government rejects that view of the world. If you have a skill that is necessary to be a care worker, you are the person skilled to do that job, and to regard you as low skilled and therefore not worthy of being recruited into our public services, I think is an anathema. And the issue that Mick Anthony was referred to and was, as he said, debated earlier today elsewhere, is part of a wider pattern in which the UK government declines to recognise the value of those people who carry out these vitally important frontline services, and that is clearly not a view that is at all shared here in Wales.
Elith Joel.
Prif Weinidog, mae'r argyfwng hwn wedi profi gwerth datganoli, ond hefyd wedi ymlygu nifer o broblemau strwythurol yn y tirlun gwleidyddol Cymreig. Un o'r broblemau hynny ydy gwendid difrifol y wasg. Yr wythnos diwethaf, roedd papurau oedd yn cael ei gwerthu yng Nghymru gyda hysbyseb tudalen flaen wedi ei thalu amdani gan Llywodraeth Prydain gyda'r neges Day Alert o ddim yn weithredol yng Nghymru, ac mae'r papurau Llundeinig yn llawn straeon sydd ddim yn berthnasol i Gymru heb fod hynny'n cael ei egluro, ac mae hynna yn achosi dryswch. Dydy'r un sefyllfa ddim yn bodoli yn yr Alban, lle mae fersiynau Albanaidd o bapurau Saesneg a llwyth o bapurau Albanaidd. Fe wnaeth arolwg YouGov ddiweddar adlewyrchu hyn gan ganfod fod 20% o bobl Cymru ddim yn gwybod digon amdanoch chi i roi barn ar eich perfformiad. Y ffigwr cyfatebol ar gyfer Sturgeon yn yr Alban oedd 6%. Y Prif Weinidog, pa gynlluniau sydd gan Llywodraeth Cymru i drawsnewid y sefyllfa hon nawr ei bod yn fater o ddiogelu iechyd y cyhoedd? Allwch chi ddweud wrtho fi os ydy'r wythnos y diwethaf wedi eich darbwyllo fod angen datganoli darlledu?
Wel, Llywydd, dwi'n cytuno. Mae'r sefyllfa presennol wedi cryfhau datganoli, a wedi cryfhau datganoli yn y meddylodod pobl yma yng Nghymru. Oeddwn ni wedi gweithio'n galed gyda'r Llywodraeth y Deyrnas Unedig, ac jyst i bod yn deg, maen nhw wedi tynnu nôl lot o hysbysiadau oedden nhw'n eisiau wneud yng Nghymru gyda'r Day Alert ac yn y blaen, ac yn diwedd y dydd oedden nhw ddim yn gallu tynnu nôl ar y pethau oedd wedi dod i fewn i Gymru o'r papurau sy'n cael ei argraffu yn Llundain. Dwi'n cytuno gyda beth mae Elith Joel yn dweud mae'n angen reidiol i ni trial i cryfhau pethau mae bobl yng Nghymru yn gallu cael oddi wrth pobl sy'n gweithio yng Nghymru, yn y wasg, yn trwy darlledu hefyd. Mae yn anodd i Llywodraeth i sefyll i fewn i'r bwlch na, anyway, achos arian o'r Llywodraeth yn codi pryderon gyda bobl os bydd yr effaith hynny cael rhoi pwysau ar bobl sy'n rhoi y newyddion i bobl i wneud e mewn ffordd mae Llywodraeth yn eisiau weld. So, ni wedi gweithio gyda'r pwyllgor, mae Bethan Said wedi gadeirio i'n feddwl am pethau ni yn gallu wneud i gryfhau y sefyllfa yma yng Nghymru, ond i y Llywodraeth yn gwneud gormod, mae'n creu problemau, mae'n helpu ni gyda rai problemau, ond mae'n codi problemau eraill.
Russell George.
Diolch, Llawydd. First Minister, in your statement today, you mentioned the ONS figures. When people hear what seems to be conflicting data in terms of cases or cases of deaths, it does cause some anxiety. People in Paris, for example, would have heard news reports yesterday saying, unfortunately, there are 12 deaths in Paris, where the ONS figures report 75 deaths. And of course, this is because of the difference between Public Health Wales and the ONS in how they report data, and the fact that Paris, of course, does not have a district general hospital, and of course, of the cross-border nature. What can you say to people who have this anxiety, and what can, which I think can cause some concern amongst people, and distrust, I suppose, as well. What can be done to make data easier to understand for the public? And also, secondly, and related, when will the data reporting to care, testing, and sadly deaths in English hospitals for Welsh patients appear in the Public Health Wales figures?
Well, thank Russell George for that. I think he gave a very good explanation himself of why there is a difference between the Public Health Wales figures and the ONS figures. And I do understand, if you're not close to these things, it is difficult for people to understand the differences. He will remember that early in the coronavirus crisis, there was a considerable call from members of the Senedd and beyond, and understandably too, for the most up-to-date information to be published as quickly as possible. And that's why Public Health Wales publish the daily figures that they publish, and they are, as Russell George has said, deaths of people in hospital. And that's capable of being brought together on a daily basis, but it doesn't represent the totality of the picture, because it doesn't include people who have died outside hospital and in the community. That is more difficult to collect together quickly because it relies on death certification. There is a lag in that, and the ONS figures, which are more comprehensive, but a couple of weeks out of date, reflect the totality of the picture. So I suppose the only advice I could give to people who want to make sure they have the most comprehensive understanding of this is that they've got to look at both sets of data. They tell us slightly different things. I think the comfort that people might be able to draw is that while the specifics in terms of numbers differ, the trends are broadly the same. So you're not looking at a completely different understanding of the picture. You're seeing the picture at a different point in time and on a different basis. But what they're telling us about the trends of coronavirus are broadly consistent. I'll make an inquiry on his second point, because I don't have that information directly with me, and I'll make sure that we write to him and let him know the answer.
Alan Davis.
I'm grateful, Presiding Officer, for the statement the First Minister has made this afternoon. I have to say, I think overwhelmingly the people of Blaenau Gwent fully support the approach that he has taken and the Welsh Government have taken over the last two months. They overwhelmingly agree that his calm and cautious approach and putting people's lives first is the approach that is best suited for our needs. And I hope he can reassure us all that he'll continue to resist those siren voices and sometimes very strident voices who tell us that we should be simply repeating slavishly all the catastrophic errors, misjudgments and mistakes that the United Kingdom government has made over the past few months. And in going forward, I very much welcome the publication of his plan, his framework for taking us forward last Friday. What people say to me is they'd like to understand more about what that means to them, how we will see the traffic light system be reflected in their daily lives over the coming weeks and months. He's been very clear about not publishing timescales, and I largely agree with that. But I think people would like to feel that they have a stronger indication of where we're going over the coming months. And
you need to come to your question now, Alan Davies.
I've asked 2 questions.
Well, that's fine then. The First Minister can respond. First Minister.
Well, first can I thank Alan Davies for the assistance he has given alongside his colleagues in reflecting the views of the people that he represents. Because one of the core reasons why we are taking the approach we are taking is because of the very firm indications we were getting from the population of Blaenau Gwent and other communities that they were fearful of an approach in which lockdown would simply be lifted and we would return too quickly to the way things were before. We've listened very carefully to those views which Alan Davies and others have faithfully represented to us, and it's made a real difference to our thinking. I can give him a complete assurance that we will continue to exercise our own judgment as to the right measures and the right timetable in which to implement them here in Wales. And what I would say to those people who want to have more definite ideas of how we will move through the traffic light system is that every 3 weeks we have to report on the state of the regulations. Every 3 weeks we are able to make adjustments to them. It will be Friday of next week. Now we're halfway through, just over halfway through the current 3-week cycle. And by Friday of next week, we will have had to have made new decisions, which I think will take us further into that traffic light system. And people who want to know more, I think will be able to see every 3 weeks at a minimum how we plan to move Wales along the pathway that we have set out.
Nigel.
Thank you, Llywydd, and I was very pleased to hear the First Minister referring again in his statement to children and young people. The impact of this pandemic on children and young people is immense, and I believe it will be very long-standing. I very much welcome the announcement on Monday of the £3.75 million extra funding for children's mental health, and particularly the recognition by the Education Minister that for younger children, traditional counselling is not necessarily an appropriate approach, and that the government will work with providers to deliver services in line with the reforms that are already being taken forward. Can I ask whether the First Minister agrees with me that in spending that money, it is absolutely crucial that we build on the whole school approach reforms and the wider system-wide reforms set out in the committee's Mind Over Matter report? And would the First Minister agree with me that as we come through this pandemic, our Mind Over Matter recommendations across government will be more important than ever before? Thank you.
Thank you, Llywydd, and thank Lynn Eagle for that. You know, our own Chief Medical Officer has emphasised right through the coronavirus crisis that it is more than just a physical illness. And while we can count, so sadly, the number of people who've been admitted to hospital or gone to critical care or indeed have died from the virus, it's more difficult to count the impact on people's mental health and well-being, but that harm is very real as well. Thank Lynn Eagle for what she said in welcoming the £3.75 million. As she knows, it extends help lower down the age range. To be 6 years old and to have gone through 3 months of coronavirus is a huge proportion of your lifetime. And the impact on that young person's, that child's life will indeed, I think, last long beyond the current crisis. So it's why we were keen to put that investment in now and to do it exactly in the way that Lynidog has said, in a way consistent with all the other measures we have taken in recent years to make the whole school approach, to put the mental health and well-being of young people at the centre of the way that we think about public services and their needs for the future, and that's exactly what we intend to do.
Gareth Bennett.
Diolch, Llywydd, and thanks to the First Minister for today's statement. First Minister, in the past you've spoken about the need for a common approach from the four nations during this crisis, and you've made reference to that again today. Now, clearly, First Minister, when we come to the end of this crisis, lessons will need to be drawn from it. Could I ask you if, on reflection, you feel there are any circumstances during a national emergency when it is right for the Welsh Government to voluntarily surrender powers back to the UK Government?
Well, so that wouldn't be my approach. Where we agree with what the UK Government is doing, as we have in huge amounts of what has happened over the recent months, we can simply exercise our powers in a way that is consistent with what is happening elsewhere. There is certainly no need to surrender powers. It's just a matter of how you choose to exercise them.
Carwyn Jones.
Can you hear me now?
Yes, we can. Carry on.
Thank you very much. Chloe, you'll be very glad to know that I don't intend to try your patience this week with a very long question, if that indeed is what it was last week. So I'll be short, but just very quickly. I'd like to remind the leader of the Brexit Party that far from the British Prime Minister being stripped of powers, the people of Wales decided in 1997 and 2011 in referendums. In fact, it was the Welsh Parliament and the Welsh Government that should exercise powers in the field of health. Secondly, I do deplore the desire by some to see Westminster as always right. It's a sign of an inferiority complex, I think, that we have in Wales, that somehow, if England decides to do something different, because it was England that broke ranks, not anybody else, then therefore they must be right and everyone else must be wrong. Time to cast off those chains. My question is this, First Minister. We know that people are able to play certain sports and to take part in certain activities, providing, of course, that social distancing is respected. My question is this then. Golf clubs and tennis clubs have been mentioned, there'll be other sports as well, but where people need to drive to get to a facility, as long as that facility is outdoors, and as long as that is their nearest public facility, or the nearest facility where they are a member, if it's the case of a club, would it be possible to give consideration as to whether further guidance might be available in order to help people in those circumstances? Clearly, we don't want people driving very long distances, but there will be some activities inevitably where people will need to drive to get to them. It's impossible to make rules for every single circumstance, I understand that, but perhaps, First Minister, if not this afternoon, some consideration might be given to just making the situation a little clearer for those people.
So I thank Karen Jones for that. I agree with him. You can't have a rule for every occasion, and each of us as citizens have to make some judgments about our own conduct, and judgments within the ambit of the rules as laid down. So further guidance, we can certainly look at that. But this afternoon, I'm very happy to say to people in Wales, there are only three questions they need to ask themselves. Are they going out for exercise? And if it's exercise, then they pass the first hurdle. Is it local? And if it's local, they pass the second hurdle. And is that exercise capable of being organised in a way that respects social distancing? And if they can say yes to those three questions, then they've gone a long way, I think, to making the sort of judgment that they need to make as to whether or not what they propose is within the rules as we've agreed them here in Wales.
Diolch i'r Prif Weinidog. Yr eitem nesaf